Friends, the entire humankind has been waging a war against this pandemic since the end of 2019. In 2020, the precious commodity was PPE. This year, however, in 2021, the place of preciousness has been taken over by oxygen. My friends from the medical and the nursing fraternity, it has been observed that oxygen, a precious commodity, I repeat, has been used rather indiscriminately. I'm sure many of you, like us, would have experienced that the frequency of refilling the oxygen tanks have been increased to a manifold. Clearly, the consumption of oxygen has increased. Either the oxygen doses are not titrated appropriately to the patient's need, or we are not careful enough in saving or reserving the oxygen. For example, it has been also observed that the patients on oxygen, due to discomfort or whatever, they just simply remove the Hudson mask and keep it aside. And we forget to turn off the oxygen knob from the main pipeline. So here goes the wastage. Clearly, that is the reason why the oxygen consumption and demand has been increased to a. Friends, I have with me Dr. Shiv Shanmugam, Professor of Anesthesiology, Mahatma Gandhi Medical College and Research Institute, Pondicherry, who will brief us the correct way of using oxygen in COVID-19 patients. Over to Professor Shiv Shanmugam.
Hi everyone, I am Dr. Shiv Shanmugam, Professor of Anesthesiology at MGMCRI. This video is to educate how to manage oxygen therapy in COVID-19 patient, and this is for internal circulation among the resident doctors and paramedics who are the frontline care workers at the COVID care areas. So in this topic I am going to discuss in two steps. The first is what is the target oxygen saturation we should aim for to maintain in COVID-19 patients, and then secondly, how to promote and maintain oxygenation at the bedside. So coming to the target oxygen saturation, we should target between 93% and 95% in the COVID-19 patients. Why we should maintain maximum of 95% oxygen saturation? Because that is the normal oxygen saturation for all of us. If you put a pulse ox probe in your finger, you will read oxygen saturation of 95 to 96%. Then why are we targeting 100% saturation in COVID-19 patients? It is not required. It is not only required, it is harmful as well. This increased oxygen flow is going to dry up the entire secretions in the respiratory tract, and the mucociliary function is going to get completely altered. And not only that, this excess oxygen is going to produce absorption atelectasis. All our efforts is to open up more alveoli and increase the gas exchanging surface area, but this excess oxygen can act against to it by producing an absorption atelectasis. Not only that, this excess oxygen induced free radicals can damage the alveolar capillary membrane, and mere oxygen administration itself can lead to an ARDS. Do you know that the people who has received liberal oxygen therapy, that is maintained saturation more than 96%, the in-hospital death or the mortality rate is more when compared to the patient who is on conservative oxygen therapy, where they maintain saturation between 93 to 95%. So this is one aspect of inappropriate oxygen administration, that is, you are not helping the patient who is sick. On the other hand, because of this reckless, irresponsible act, you are denying an oxygen for the other patient who deserve for it because of short supply of oxygen. We are in that situation now. We have 6,000 liter capacity liquid oxygen tank where we used to fill once in a week. It has become once in 5 days, then once in 3 days, once in 48 hours. Now we are filling every single day, but still we are not able to maintain the oxygen pressures in the pipeline. So now the target oxygen therapy for COVID-19 patients is 93 to 95. In your care area, if you see some patients who is registering the SpO2 of 96% on oxygen supplementation, and you are not taking any active steps to bring down the FiO2, then you are not helping the patient. Instead, you are trying to kill them. Having said that, how to promote and maintain oxygenation function of the lung at the bedside, because the lung is the key organ dysfunction we are facing in COVID-19. For that, the first and the foremost thing is you should know how much oxygen that you are administering to a particular patient. This you can know only when you use a Venturi device for oxygen supplementation. If you just put up a simple Hudson face mask and turn up oxygen 6 liters, 8 liters, 10 liters, you are simply failed in oxygen therapy because you are not knowing how much oxygen you are administering to the patient and where is the question of titration. So now, for example, you are using a Venturi device of 60% and your patient is maintaining oxygen saturation of 95. After some time, you are seeing it is reading 96. The moment you observe 96% on the monitor, you have to step down your oxygen supplementation to the next lower level, that is 40%. Moment you reduce this, patient is going to desaturate a bit. Now the saturation is coming down from 96, 95, 94. Don't do anything. Don't be panic. Hold on. Because any change in your oxygen settings, it is going to take minimum 20 to 30 minutes for the oxygenation to stabilize. During this time, instead of passively watching what happens or turning up on oxygen, you have to aggressively work on the patient, educate them to do deep breathing exercise and prone positioning, which is only going to help them to improve their oxygenation. So what are all the deep breathing exercise that we can do? A simple vital capacity breath maneuvers. Vital capacity means maximum inhalation and maximum exhalation. This simply patient can sit erect with their spine erect. By this posture, both the thorax and the abdomen is free to expand. So the patient can comfortably sit and take a deep breath as much as possible and then exhale completely out. The duration can be varied. There is no hard and fast rule. It can be 2 seconds, 3 seconds, 4 or 5 seconds, whichever is comfortable. They have to take a deep inhalation and deep exhalation or full exhalation. Suppose if they can do about 15 to 20 breaths at a stretch. Every hour they can repeat, or whenever they are conscious of, they can do this. Suppose if the patient is doing this efficiently without any problem and they are finding sense of well-being within themselves, you can ask them to hold the breath for a second at the end of inspiration and then exhale. This holding breath inside will further facilitate recruitment in the alveoli and it can help the patient to improve the gas exchanging surface area. Suppose if the patient is not able to take a deep breath or hold, forget it. Just mere observe their breathing, their tidal breathing. If the patient is bring their attention from thinking, divert it to the breathing, just a simple rhythmic tidal breathing itself, a mindful breathing itself will reduce the mind activity and it will bring down the respiratory rate. If they do this mindful or observe their own breathing for about 5 to 10 minutes, you can see the difference in oxygen saturation. Their pulse rate will drop and their respiratory rate will come down. So all these maneuvers can be done in the prone positioning as well. These respiratory maneuvers and prone positioning will help only for patients who are not tachypneic. That means they are not in respiratory distress. Their respiratory rate is less than 25 or 20. And you know very well, these are all the patient or significant in number and they are going to consume significant amount of oxygen. Now, with 40% oxygen, you are doing all these respiratory therapy maneuvers and the patient is maintaining saturation at 94. After some time, the saturation drops from 94 to 93. Hold on, don't be panic. Aggressively continue to do all these respiratory therapy maneuvers for another 20 to 30 minutes. The small change in partial pressure of oxygen in the blood because of this difference in 1 or 2 saturation is not going to affect the patient in any way. The more important thing is you are recruiting the lung. This is what is more important. So you are continue to do. After 30 minutes, the saturation drops from 93 to 92%. This indicates the available surface area is not adequate enough to sustain the saturation with 40% oxygen. Now you step up. Whenever you see a saturation of 92%, you step up from 40% to 60 and continue to do all the recruitment maneuvers for the next 3 to 4 hours. Or whenever you see again saturation of 96, you have to bring down the oxygen supplementation. So now the strategy or the target saturation, what we have to aim is from 93 to 95. Whenever you see 96, you step down the oxygen. Whenever you see 92%, step up the oxygen. Between 93, 94 and 95, hold on, do an aggressive respiratory therapy maneuvers and prone positioning to sustain the oxygenation. We have to educate the patient and teach them, explain them the oxygen is not the treatment for COVID, it is symptomatic. And by maintaining saturation with oxygen supplementation is not right. This oxygen itself will harmful to their lung. And they have to maintain their saturation with their own alveolar capillary membrane, and 21% oxygen only is safe. Moment they understand this, they will going to cooperate with all your respiratory therapy maneuver. For this, you have to spend at least 5 minutes of a quality time with each patient to begin with. You have to teach them, explain them, make them understand and show them once how the improvement happens. Once they see this by their own eyes and feel the sense of well-being, they are going to sustain themselves. You need not chase them at all. Only when you do like this, we are actively managing the oxygen therapy in COVID-19 patients. Otherwise, we are just a layman bystanders who are just turning the oxygen knob every time oxygen saturation dips. In that way, we are not going to protect them. We are harmful to them. So I request each one of us to be an active oxygen therapy manager than just a layman bystander who witnesses how the patient deteriorates. So I request all the consultants as well as the nursing supervisors to ensure and educate in their care areas this happens. And I request my departmental colleagues to come up with videos how to use individual, how to choose as well as use individual oxygen therapy devices in subsequent videos. Thank you very much for kind attention.
Thank you, Dr. Shiv Shanmugam, for elaborately explaining the judicious and rational use of oxygen in these trying times. Thank you.